Hello and welcome to my YouTube channel. Myself Keyur Limbache. I am a final year medical student from Jimar Sola, Ahmedabad. Today in this video, we will discuss the basic concept of central nervous system. Why am I recording this video? Because CNS as a topic, a lot of students from the first and second year find it very difficult to understand. Actually, it's not difficult because they cannot find a way to uh, understand the basic terminology in earlier time of their MBBS. So the main purpose of making this video is to clear their concept in order to get proper concept of central nervous system in medicine in later years. So let's just start this video without wasting further time. Okay, so central nervous system has got two main thing. One is brain and second is spinal cord. In this video, we will discuss on the brain first. So brain, it is located inside the skull. It is a bony covering that protects brain from outside injury. Now in the skull, three things present. One is brain, second is blood vessels, and third is CSF. Apart from these three structures, there is hardly a space present inside the brain. So if there is problem in one of the structure, let's say if there is increase in CSF, so these two structure has to compromise, and mainly in this situation brain is the structure that compromise in this situation. So when there is a accumulation of the blood or CSF, brain tissue will get damaged or compressed. So in injuries, this concept is very important while understand the pathology in hydrocephalus or hematoma and all. Okay, next is structure. It is mainly formed by the neuronal cells and glial cells. A lot of tissue of neurons and neuroglial cell present inside the brain, which has a various function. We will discuss it later. Then parts. Has got lobes. Frontal lobe, parietal lobe, occipital lobe, and temporal lobe. Frontal lobe has got the motor function, or let's say a personality, thinking. These are the function of frontal lobe. Yes, speech mainly because Broca's area is located in the frontal lobe, but speech is contributed by different types of lobes. Then parietal, it is mainly a somatosensory. Like whenever somebody touch you or when you get pain, but pain mainly comes from thalamus, but yes, somatosensory vibration and all kind of sensation that are the end point of all this sensory stimulation comes inside the parietal lobe, and in this lobe it gets integrated, and according to the stimulus characteristic, it gets stored. Then occipital lobe has got the main function of vision, and temporal lobe has got the function of hearing, right? So when there is a problem in frontal lobe, it got the motor abnormality, or in a frontotemporal dementia, or only a frontal lobe involved in dementia, so that cause the personality changes, right? In somatosensory, loss of sensation, and same is vision and hearing problem occur when there is a lesion. We will discuss later, but yes, so these are the main parts of brain. First First is the cerebrum, second is cerebellum. We will discuss at the end of the video about cerebellum, and third is brain stem. Okay, so this was all about the first brain and its parts like cortex, cerebral cortex. In cerebral cortex, you see there is a thick nuclei of the neurons, which means they are called as okay. Let's discuss the gray matter and white matter. What do you mean by gray matter? Gray matter means collection of neuronal cell bodies, which means this. Here, this is the neuronal cell. The cell body contains a lot of neuronal cells, right? So when these accumulated inside the brain, it is called the gray matter, and these fibers like axons, they are called as white matter, right? White matter means the axons of the neuronal cells is called white matter, and gray matter means nuclei, which means nuclei of the neuronal cells, right? Okay, what do you mean by ganglia? Second is ganglia. Ganglia and nuclei is similar, but its main difference is about the location, which means when gray matter is located inside the brain, it is called nuclei, and when this gray matter is located outside the brain, it is called ganglia. I'm sure you must be thinking why basal ganglia are called as ganglia, even if they are located inside the brain. So it's that traditionally it has been called since long time, but actually it should be basal nuclei. But they tell that it's a basal ganglia, so it's like. But actual concept is ganglia means collection of the neural cell body, which means gray matter outside the brain is ganglia. Let's say parasympathetic ganglion, sympathetic ganglion, dorsal column ganglion, right? Nuclei mainly located inside the brain. They are a cell body of the various neuron. Let's say this a caudate nucleus, putamen, amygdala, then this inside the midbrain there is a red nucleus, right? Pons, mammillary body, these all are the nuclei. Let's discuss about the ventricles. Ventricles are the communicating cavity deep inside the brain that has the main function of secreting and reabsorption of cerebrospinal fluid. So it is situated in the brain, and it has got 4 ventricles. One is a pair of lateral ventricle between the 2 hemisphere. This, you can say this is the lateral ventricles. These lateral ventricles are connected to the 3rd ventricle by the interventricular foramina. From this ventricle, 3rd ventricle, it is situated in the diencephalon between the thalamus and hypothalamus. They are called it is called the 3rd ventricle. And now this 3rd ventricle is connected to the 4th ventricle by a cerebral aqueduct. What it is called? cerebral aqueduct. And now this fourth ventricle is connected with the spinal cord via central canal. So ventricles are a communicating cavity inside the brain which synthesize CSF and has four parts: two lateral ventricle, one, it means the third ventricle, and fourth ventricle, right? Pathology. Now this fourth ventricle is between the brainstem and cerebellum, so it is called the fourth ventricle. Pathology is a hydrocephalus when there is an excessive accumulation of the cerebrospinal fluid in this ventricle. This enlarges, and from outside you can see there is an enlarged head, so it is a hydrocephalus. Okay, let's talk about the meninges. What is meninges? Meninges are the outer covering of the brain, right? It is a fibrous connective tissue that covers the brain. It is situated outside of the brain, right? Made up of connective tissue. Structure. It has got mainly three layers. One is called the dura mater, outermost covering. Then there is a arachnoid matter, middle one, and then there is a pia mater. This pia mater usually are adhered. Usually means normal. It is adhered in the cortex, so it cannot be separated during dissection, right? So these three are the main structure of main layer of the dura mater. You can see this one is skull, then this is a periosteum, this purple one is a dura mater, and this pink is arachnoid, and this is pia, right? Now this along this arachnoid and pia mater, both are called as the leptomeninges. So in this diagram I would like to tell you about the small concept of CSF. Okay, so as I discussed that CSF is formed in the ventricles, right? Let me tell you about the space between these meningeal layers, right? So a space above the dura mater is called epidural space. Below, or means dura mater or arachnoid, it is called a subdural space. Then arachnoid and pia mater, it is called a subarachnoid space. And what is called above arachnoid? There is no such, because it's already been called as a subdural space, right? So what is the significance of these spaces? When you talk about the epidural space or subdural space, it will be discussed in surgery when there is a trauma, blood collection in this space. So it is a surgery topic. Now the arachnoid space, subarachnoid space, it is very important. Why? Because mainly two structure related to this subarachnoid space. One is CSF and second is blood vessel. As you know, all the blood vessel from the carotid artery, then there is a circle of Willis, you can say that a middle cerebral artery and other arteries present inside the subarachnoid space and the CSF, right? So this is very important as a clinical point of view, subarachnoid space. Okay, let's discuss the CSF flow inside the brain. Now, before going into the CSF flow, I would like to tell that as I discussed earlier, there's this meningeal layer not only just present outside the brain, it also covers the spinal cord as well. So this epidural space, subdural space, and subarachnoid space also covers the spinal cord, right? Okay, now the CSF flow. In adult, the CSF cerebrospinal fluid synthesized as approximately 500 ml per day, right? And the normal pressure is 7 to 18 centimeter of H2O. This is the normal range of CSF pressure. Now, how it gets synthesized? As I told you that there is a structure called a choroid plexus in the ventricle. This choroid plexus is made up of capillaries of venules and arterioles that secrete the CSF, and this also present in the third and the fourth ventricle. From this lateral ventricle through the foramen called the foramen of Munro goes into the third ventricle, and the third ventricle it goes into the structure called the Sylvian aqueduct or cerebral aqueduct. From this cerebral aqueduct it goes into the fourth ventricle, and from fourth ventricle it goes into the central canal of spinal cord, right? But this is in the central system. But what happens when there is a what actually occur when there is the CSF present in the fourth ventricle? It goes into the lateral foramen called the foramen of Luschka in this to the subarachnoid space, right? From the fourth ventricle, this CSF flows into the subarachnoid space through foramen of Luschka, and median foramen is called foramen of Magandale. From this fourth ventricle, it goes into subarachnoid space that covers all the periphery of the blood, and it reaches like this in the subarachnoid space, right? Now, how it gets secreted from the subarachnoid space? So for this reason, just focus on this diagram. The structure which is this blue color is called the dural venous sinus. Dural venous sinus is nothing, just a fold of dura mater, right? It is just a fold of dura mater. The parietal and the visceral layer of the dura mater it fold and form a sinus in which the blood runs of it is a vein of the, you can say, the veins of the brain, right? So from the subarachnoid space, when the CSF comes at this fibrous septa or fibrous space is this subarachnoid space. Just focus on this diagram. Now this fibrous septa is called the arachnoid septum, right? And these are the blood vessels, as I told you, the blood vessel present in the subarachnoid space, and these are the CSF, right? When the CSF comes at this structure, now this structure is called the arachnoid villi, and together these all arachnoid villi form the arachnoid granulation, right? So the CSF present in the subarachnoid space filtered through this arachnoid granulation inside the dural venous sinus. So now from this dural venous sinus it gets into the blood system, and from the blood it again reaches to the this choroid plexus, and from this choroid plexus it synthesizes again. That's how CSF cycle flows, right? Now the pathology of CSF is when there is an obstruction. Why there is obstruction? Because of this Sylvian aqueduct is not formed. This congenital stricture present in the this Sylvian aqueduct, or there is a pathology like meningitis, tuberculous meningitis. So this also got obstruction. That's granulation tissue form over here as well. This will lead to the obstruction. So all this CSF will not able to move from the ventricles to the inferior part, right? So it got obstructed, and this will increase the ventricular size, and this is called the hydrocephalus, that will lead to the macrocephaly, means increase the size of head above the normal range. So this is the pathology regarding the CSF. Okay, so let's talk about the brainstem. After having the basic understanding of the brain and its various structure, let's discuss the second important part is of brain is the brainstem. Brainstem basically is the stem, which means it is the most important part of the whole central nervous system. Like a tree, if you cut the stem of a tree, the tree will fall. Just like if there is a lesion in the brainstem, the person will called as a brain dead or patient may die. Why? Because brainstem has got enormous function, very vital function. The first means the main is the centers like respiratory centers present in the brain or vasomotor center that regulate your heart. It also present inside the brainstem. So this is very vital function of the brainstem. Now what are the parts of brainstem? Brainstem has got mainly three parts. One is the midbrain, the uppermost, then middle is the pons, and lower is the medulla oblongata. Right? Okay, let's talk about midbrain. Midbrain is the upper part of the brainstem. Now, when you take a section of midbrain from this, you will get this section, right? This part is called the tectum, right? Tectum, and this has a superior colliculus, which is related to the vision. This middle part is the tegmentum. There has a lot of tract like a spinothalamic tract. Then there is a red nucleus, right? This is the red nucleus, very important. Rubrospinal tract. There is a tegmentum. This structure is called the crus cerebri, or you can say cerebral peduncles, in which all the fibers from the cerebral cortex goes down through these cerebral peduncles like a corticospinal tract, then other fibers, white fibers that connects the brain to the cerebellum as well also goes from here, right? So this is the cerebral peduncle, and this structure is called the substantia nigra. Substantia nigra has got two parts. One is pars compacta, the violet one, and the other is the pars reticulata. The pathology is that then when there is a Parkinson disease, the dopaminergic neurons depleted or degenerated in this pars compacta substantia nigra. So in this condition, there is all the signs and symptoms of the Parkinsonism occur to the patient. Pons. Pons is situated between the midbrain and medulla. Now the function of pons, main function of pons is that it connects the cerebellum to the cerebral cortex through a middle cerebral peduncles, right? So from the cerebral cortex, all the information goes into the cerebellum through the pons. Basically, pons means a bridge, right? Second important function is reticular activating system, in which when your sleep or sleep awake cycle, it is also regulated by pons. Your dreams. This is the function of pons. Third is your breathing and heart rate. These all are regulated by pons, various nuclei present in the pons, right? So, and when there is a pathology in the pons, when there is a stroke that supplies the pons blood vessel and causes problem in speech, balance, and all. One thing, that when there is a pontine hemorrhage, that cause you the pinpoint pupil, right? So it is a DD of pinpoint pupil when there is a OP poisoning, then this pontine hemorrhage. Okay, let's talk about medulla oblongata. Medulla oblongata is situated between the pons and the spinal cord. From the medulla oblongata, a lot of structure passes above and down. Like from the spinal cord, a structure or a tract called the dorsal column medial lemniscus. It is a DCML tract, right? I will discuss detail in the next few videos, but this is the structure of fasciculus cuneatus, this, and this is the gracilis, right? From here the fibers of this decussate and will form the medial lemniscus, and together they are called the dorsal column medial lemniscus. This is the spinal nucleus of trigeminal nerve, fifth nerve, right? And the other important structure is this, like first is the 12th cranial nerve hypoglossal, then this is the dorsal nucleus of vagus nerve, then this is the nucleus tractus solitarius, which is mainly related for the taste, right? And other important structure are the vasomotor center and all. So the important pathology about the medulla oblongata is when this structure involved, this is called the lateral medullary syndrome, and when this area involved is called the medial medullary syndrome, right? So it will be discussed in neuroanatomy detail, but this is all about the. Now another important structures that comes out from the brainstem are the cranial nerves. It is very important because all the cranial nerve from the first nerve to the 12th cranial nerve, which is the hypoglossal nerve, that comes out from the brain stem. I will make a separate video on this brainstem, how cranial nerve gets originated inside the brainstem and how it will come out from the cranial foraminus. Let's talk about cerebellum. Cerebellum is the most important part of central nervous system as far as the motor system is concerned. It is situated in the cerebellar fossa of the occipital bone. Right? It has got three lobes. One is the anterior lobe, second is the posterior lobe, and the third one is the flocculonodular lobe. Each lobe has a different function. Now, functionally, it has got three parts. One is the vermis. Vermis is the median part of this lobe, which has a part of primary lobe as well as the posterior lobe, means part of the anterior lobe as well as the posterior lobe. This is the vermis. Second is the flocculonodular lobe, and the third one is this cerebellar hemisphere. Between these there is an intermediate zone as well, right? So I have discussed the location. It is located in the cerebellar fossa of the occipital bone. Now the structure is already been discussed, that it has got a vermis, then intermediate zone, then there is a flocculonodular zone, and there is a lateral cerebellar hemisphere. Functional it is very important. It has got three part. One is a vestibulocerebellum. Second is spinocerebellum, and the third one is cerebrocerebellum. Right? Now this vestibulocerebellum is a flocculonodular lobe. Floccules and nodule. So this is a functionally vestibulocerebellum. Spinocerebellum is a vermis part, and cerebrocerebellum is a cerebral hemisphere. Now this vestibulocerebellum has a main function of balance, right? And the spinocerebellum is I'll talk later about this. And the okay, let me tell you first. Spinocerebellum is it's a tract that get the information of the various distal limbs through the spinal cord to the cerebellum, right? And why they need this information? Because it is demanded by the cerebrum. Now, what is cerebrocerebellum? Cerebrocerebellum is the means major part of the cerebellum, right? So, okay, अभी ये मैं हिंदी में बताता हूँ पूरा मैकेनिज्म क्या होता है cerebellum का, ठीक है? ओके, सो जस्ट थिंक के आपको एक चाय का कप लेना है एंड यू आर सिटिंग ऑन अ चेयर एंड योर कप ऑफ टी इज लेट्स से 5 feet distant, right? So if you want to take a cup of tea, first the idea should come in your mind, right? What idea? The idea of taking cup of tea, but you are sitting on the chair which is 5 feet distance. Now उसके बाद क्या होता है? When you get the idea that I want to take a cup of tea, your brain share this information to the cerebellum. Why? Because our motor cortex needs that which muscle will be used. Let's say if you want to in this situation आपको क्या करना पड़ेगा? आपको चेयर में से खड़ा होना पड़ेगा, ठीक है? तो उसके लिए आपके कौन कौन से मसल यूज हो गए, उसके लिए आपका ब्रेन सबसे पहले सेरिबेलम को ये देता है कि मुझे चाय का कप लेना है. नाउ व्हाट इज द रोल ऑफ सेरिबेलम इन दिस सिचुएशन? सेरिबेलम will assess all the muscle movement at this current time, which means आपके नी का पोजीशन क्या है, आपका शोल्डर कैसा है, आप बैठे हो या खड़े हो, आपका like whatever your joint position, this will be assessed by the cerebellum, right? Through the spinocerebellar tract. This is what I want to tell you. So आपका जब सेरिब्रम जब वो कमांड देगा कि मुझे चाय का कप लेना है, तो सेरिबेलम का रोल क्या है? वो आपके सेरिबेलम को ये असेस करके देगा थ्रू दी स्पाइनोसेरिबेलर ट्रैक के ओके यहाँ पे जॉइंट पोजीशन यहाँ पे है, ये मेरा राइट लेग फोल्डेड है, लेफ्ट लेग एक्सटेंडेड है, देन माय होल शोल्डर आर स्ट्रेट, दिस इज द पोजीशन. नाउ थ्रू दी स्पाइनोसेरिबेलर ट्रैक this information gets collected by the cerebellum. Now this cerebellum will give this information to the cerebrum through the cerebrocerebellum, right? Now अब क्या होगा? जब cerebrum के पास पूरा information आ गया, तब भी अब cerebellum का रोल खत्म नहीं हुआ, क्योंकि जब वो खड़ा होगा, जब वो खड़ा होकर बाद जब चाय लेने जाएगा, फिर भी उसको पता रहना पड़ेगा कि उसका वेलोसिटी कितना होगा, कितनी देर में जाना पड़ेगा, कितनी स्पीड से जाना पड़ेगा. So this will be assessed by the cerebellum, right? So this is just a brief. I will discuss whole cerebellum in detail, but I wanted to tell you that cerebellum is extremely beautiful organ of the brain that has this ability to like coordination. This is the most important function. Okay, so I will discuss later in detail about the cerebellum. Okay, so this was all about today's lecture. I have made a lot of efforts to create this lecture. This was my first long lecture because I wanted to deliver some basic concept regarding this neuroanatomy. As this is my first lecture, so there might be a lot of editing errors, or please don't mind, because this is the first time I'm recording a long lecture. But if you have any doubt, please feel free to ask anything related to this particular topic, or you find any mistakes throughout this video, you can also share to this comment, and please like this video. And I'm giving you the promise that I will make more clearer videos from this. And the most important thing is that your neuroanatomy or your neurology will be very easy from this, right? I will make a second video on spinal cord and tract, right? This tract is extremely important throughout your mbbs, right? Spinal cord, what is root value, what is this, what is all kind of stuff about central nervous system. So thank you so much for watching this video till the end. If you have found something good for you in this video, then please like and share to your colleagues, especially to the first year student. And don't forget to subscribe this channel and press the bell icon to never miss an update. This is Kero Limbachia signing off. Meet you to the next video. Thank you.